Hi, myself Dr. Geetha, consultant pathologist in Plasma Medinostics. Today I'll be briefly telling you about the dengue fever and the tests that we have in a Plasma Medinostics for the diagnosis of dengue fever. As we all know, it's a rainy season, so there is an increase in the mosquitoes as well as the dengue cases. Coming to the dengue fever, it's just a viral fever caused by a bite by a mosquito called as Aedes mosquito, especially it bites in the daytime. So whenever a patient has a dengue fever, they will have a high-grade fever, headache, myalgia, that is muscle pain, bone pain, even pain while moving the eyeball, that is one of the specific feature which we see in a dengue fever. And also there will be redness of the eyes, as well as sometimes the patient can also have rashes. So why to worry about the dengue fever? That is what we have to know. Even though dengue is a viral fever, it is one of the disease which we should be very cautious. That is because it will cause sudden fall in the platelets. So as we all know, the platelets are the cells that are present in our blood which will clot the blood when it starts bleeding. So whenever there is a dengue, there will be sudden fall in the platelets, which if the platelets go beyond less than 10,000, then the patient will start having bleeding all over the body, which can cause the death. That is why we should be very careful about the dengue fever. Coming to the tests, we have two types of tests. One is to detect the antigen that is present in the dengue virus, and also to the antibody to the dengue virus. The dengue antigen, NSA1, will diagnose the dengue fever in a very early stage, and antibody in a day 3 or day 4. So whenever you're having high grade fever, headache, all those things, day 1 or 2 you can manage at home with just a plain paracetamol to control the fever, but no other antipyretic or analgesic should be taken, because if it's a dengue fever, it will worsen the disease. So coming to the tests that are available in the Plasma Medinostics, we have a dengue profile which will check the antigen of the virus as well as antibodies. So in day 3 or 4, the antigen might come positive. In day 4 or 5, even the antibodies will come positive. And also with the dengue profile, you should get your CBC done. CBC is a complete blood count where you can see the platelet counts also. And one more option that is available is we also have a fever panel. Along with the dengue profile CBC, we do other two tests, that is test for the malaria and typhoid, which can also cause the fever. So do avail the services which are available in the Plasma Medinostics. Stay safe and healthy. Thank you.